We had just dropped a patient off at Williamson, returning to our zone in Nolensville, and I got a call from my mother.
I knew I was feeling funny. I was talking to my wife, and as I find out, I'm making no sense at all.
She said, well, we've taken his blood pressure. It's about 70/40. He's really confused. We showed up at the house, verified his blood pressure is very low. He's really pale. He's tachycardic, definitely in shock.
I was in the ambulance and still thinking, this is not that big a deal, until the doors opened and then somebody came with a unit of blood.
As soon as we administered the blood, he became non-critical. And it definitely turned him around real quick, that you could see like his color came back, his vitals stabilized, his heart rate came down, blood pressure came back up. Definitely did save his life.
We are the only department in Tennessee that if you call 911, we'll provide the blood to you at your home, on the side of the road, wherever you need us. We're really proud to be the ones that kind of got this started in Tennessee. We believe we're making differences in people's lives.
Administering blood in the right clinical setting is what's key here. You don't want to be administering blood to patients who do not need blood. We keep very tight scrutiny over the refrigeration of the blood and the preparation of the blood, the cooling process and the monitoring of the blood in the field to make sure that it meets all the standards required by the hospital.
We have packed red blood cells that are both O negative and O positive, and also we carry liquid plasma. So we carry those products in one of our supervisor vehicles, and it can respond anywhere in Williamson County, anytime, 24/7, to deliver those products to a field provider that has determined they need those for administration to a patient.
The types of cases that we see as far as that indicate that blood loss, like you mentioned, trauma, you also have the GI bleeds. Those are quite frequent. You also have potential blood loss with the peripartum patients, the pregnancy complications, those kinds of things.
So the training is intense, and it should be. The training involves a multitude of different scenarios, case studies, the pathophysiology of the blood products, the answering the why we need to give these products to the patients. It means so much to us to be able to have the opportunity to take this leap in steps for our state, not only the community, but we're leading the trend for the state. And we have multiple different departments around the serving area that are looking to us to be the primary example because we set the bar high.
I don't know that I would have made it. I believe it bought me the time I needed to get to the hospital.
If blood is the answer, having it and the ability to administer it in the field at that time can be critical. And we've had several cases where it's clearly been the difference between life and death. It's been the difference between somebody making it to the hospital alive or not.